The COVID-19 that has evolved is now more problematic. It causes not just the common cold symptoms, but now it causes bronchitis and pneumonia, which is inflammation of the lungs. And when it progresses, it could also involve other organs and eventually lead to respiratory failure and other organ failures and possibly death. A common recommendation is to wash your hands frequently. When you are coughing, cover your cough, preferably with a piece of tissue and then discard it. Try not to touch your face because the virus lives on various objects, and when you open a door and if there's a virus on the door, then you touch your face, you inoculate yourself. Keep 6 feet distance from people who are ill, or 6 feet distance in general to prevent the spread from one person to another. And stay healthy, eat well, sleep well. Just do all the things that are very commonsensical to stay healthy. Sometimes people feel like they need to do that, and sometimes it is a good idea, but be wary when you are out. Again, continue to keep the 6 feet distance, continue to observe and cover your coughs, use common sense. If you have to go to the store, please go and get what you need, but again, try not to congregate because it's the close contact that helps spread the disease from one person to another. When the virus was causing problems out of China, the report coming out of China was that the majority of the moderately to severely ill population were over 60-65 range. Once it left China and it's got into Europe, Italy too was seeing the similar circumstances. The patients over 60-65 immunosuppressed having underlying respiratory cardiac problems were the ones that suffered the most. Over time though, as it reaches the United States, we're seeing a little bit of a change. We're still not sure, but we're seeing more people, younger people in their 40s and 50s being affected. It can affect us all. So this virus is very similar in genetic makeup to the SARS virus 2002, 2003 when it broke out also in the Hong Kong, China area. It came out in November 2002, and by May 2003 it burned itself out. By July of 2003, the WHO declared that the infection was over. This virus, again, very similar to SARS, 90-95% genetic homology. So there's hope that it will behave the same. Another thing that we are learning is that about 80% of patients who get infected with the virus are either asymptomatic or mildly symptomatic. So that's helpful because if 80% of the population gets infected and is mild, then not everybody is going to require hospitalization and intensive care and death. So in a way that's reassuring that most of the time it's a mild disease. If you happen to think that you have the symptoms of the coronavirus infection, usually it's a triad: fever, cough, and shortness of breath. If you have that and you are concerned, the recommendation is to call your physician's office and get a telephone appointment. Based on your visit with the provider, they can determine if you should get tested or not. Currently, because testing is not very widely available, the physicians are only testing the ones that are at the highest risk. So that's the case right now. If you have symptoms and the test is widely available, eventually any one of us can be tested and be sure and have a peace of mind that you have the infection or not. On an annual basis, we deal with influenza. Influenza's infectivity is similar to this coronavirus. We all know how to wash our hands, keep our distance, etc. So continue to follow the guidelines put out by our health agencies. The current isolation policies are really helpful because it reduces the spread and reduces the surge of moderately or severely infected patients. Continue to protect each other by following the isolation rules, wash hands, not touch your face. This coronavirus broke out in December, late December, early January. From the reading of the literature, it was very similar to SARS. So we've dealt with SARS back in 2002, 2003, so I was concerned but not worried or panicked. As the infection begins to become a pandemic situation, I'm beginning to see reports that we may have some treatment at this point, and that we just need to make sure we control the speed of infection, of spread of infection, and not let it develop into a significant surge. But I'm hopeful that the current medications we have will do its job. But this is a time of stress for us. It is also a time that we should be kind to each other. There are older patients who are required to be in isolation. Please check in on them. Make sure they get the nourishment they need, the company, maybe by phone or by video. Make sure you check in on them. Just be kind to each other.